So how did you meet Francisco? How you got to meet him and you heard about him?
So I met him at the biomedical center. We went there. My wife went there because she has breast cancer that metastasized, and so he was our doctor. And we talked, and I liked what he had to say because he was the first time we'd been at that clinic for 5 years, and he was the first doctor that ever said, "I want to kill your cancer." And I said, "Well, yeah, we want you to kill the cancer. We don't want the cancer just sitting there dormant. We'll get rid of it." And then we left, and some things had happened in our life. But I stayed in contact with him through email. I was always in contact, and he would always answer. This is what I loved about him. I could write him an email, and he would always answer me. And so I had friends that were going through some terrible things, and I could call him up and ask him questions. I could say, this friend was diagnosed with mesothelioma, and he said, "Oh, you know, if you can get him down here, I think I could help him." So that impressed me. He was always willing to help. And then when my wife's cancer changed, is that what you'd say? It changed. It went from estrogen positive cancer to HER2 positive cancer. I emailed him, and then he said, "Let's talk on the phone." I talked to him on the phone. Well, after we talked for an hour on the phone, and I said, "Okay, where do I send you? So I probably have to send you some money, right?" He said, "No." "Well, why would you have to send me money?" I said, "Well, we just had a consultation." "No, there's no fee in the consultation." "Oh, really? That impressed me." He was willing to give his time, and so we made arrangements. And we came down, discussed what a treatment plan. He told me about his website. So when we got down here, again, we discussed what type of plan he had for her. It made a lot of sense because I had been doing my own research. I knew some of the things that he was recommending, like the bisodicarbonate, the chelation, vitamin C infusions, all those things. I'd already done my research, and so and then I can ask him any question. And then what I really have enjoyed, we've developed a rapport to where we could sit down and just spend time and just talk. We can talk about anything, and he'll just take the time and spend with us. Whereas our doctor back in the States, we get 5 minutes, and then he's gone. So.
And you do, and so here's Debora. She's having what's the chelation? What do you have right now?
Right now I'm having a vitamin C infusion.
Vitamin C infusion.
Yeah.
Okay, she's been living with cancer for how many years?
18 years.
18 years. Mm-hmm. So you do your chemo in the States, and right afterward, that's when you come here.
Yes.
To have your treatment.
Mm-hmm.
And what does the treatment do for you? Can you describe it?
When you have chemotherapy treatment, it often is very hard on the body, makes you tired, it disrupts your intestinal system, it takes your energy, makes you sick, makes your hair fall out, a lot of unpleasant side effects. And so by coming here, we feel like we're counteracting a lot of those side effects. The chelation, the DMSO, the vitamin C, all of those infusions are meant to cleanse the body so that my liver can remain healthy and I can have a strong immune system. I'm monitored, my blood work is monitored here as well as in the States. My cancer markers are monitored, and those are all watched closely to determine that the treatment I'm getting is still working. So. And
you have cancer. What type of cancer do you have? So
I have HER2 positive +3 cancer now. That's a second metastasis for me. I had estrogen positive cancer in the beginning, which started with breast cancer. That metastasized to the bone 11 years ago. So I've been stage 4 for 11 years. And I'm still surviving and surviving pretty well.
And you're still being active?
Very active. I still exercise. I'm very involved in the ministry work that I feel is very important. What else do I do? I still work some. I work when I want to. I'm at an age where I can retire if I want to, but I still do some jobs if I feel like I want to take them on. I have the energy to do that. So by coming here, I feel like I've elongated my chances for a healthier life, to combine all the different types of treatment. And Dr. Martinez is very informational. I think we appreciate that part. We can ask any question. He never gets offended if we ask questions or if we question him. I'm a big questioner. And he never seems to get irritated at me or wonder why I'm asking something 2 or 3 times. So it's refreshing to have a doctor that listens to you.
So he combines the treatment you're having now with the one you're having in the States, right?
Yes.
So
We're
yeah,
both completely in combination, and each doctor knows what I'm doing. My oncologist in the States knows what I'm doing here, and Dr. Martinez knows the drugs and therapy that I'm doing there. That way I feel like everybody is informed.
okay.
There's no secrets or anything.
But
about
you tell him what you tell him the treatment you're having in the States, right? It's
I
personally.
Yes, but I also give him my test results from there.
Oh, okay.
He each gets the test results of the other.
Oh, okay, perfect.
Yeah.
All right. Any other word regarding the?
Yeah, and what we appreciate coming here is that he treats the whole body. He's not just in the States. They're just concerned about the cancer, where the cancer is presently. That's all they're treating. Whereas Dr. Martinez has discovered some other things that she's dealing with, and so he's addressed those, and so that he wants. It's not just about treating just one aspect of it, but treating everything, because that it all is in harmony. And if you don't treat it, you're just going to create other problems somewhere else. I mean, even recognized that she had arthritis that was causing problems, and helped us to appreciate how in the States they don't treat arthritis. They just tell you to take some, Advil for your arthritis, and they just let it go. Where he's very concerned about treating also her arthritis, getting her inflammation down by infusions, using some, what is it he uses?
Anti-inflammatory infusion, yeah. Each time I come, he does anti-inflammatories, which takes the swelling out of my joints, lessens the swelling in my ankles, and gets rid of pain. I actually desisted in April when we first started coming here. I was on pain medication, and I have not been on any pain medication other than Tylenol since I've been coming here, 6 months, and I have bone cancer. So that's pretty amazing. That's a very painful type of cancer, and these infusions have helped to allay pain in a natural way without having to use opioids for pain treatment.
Yeah, we appreciate there's no narcotics that are involved in the treatment here, and so that's very important to us.
Okay, well, thank you for your testimonial. I hope it's going to help other patients like you. They were really nice patient. And it was a pleasure receiving you here.
Yep.
Thanks. Bye.
Bye.